Good afternoon, everybody. My name is Jenny Smith and I'm the Chair of Homelessness Australia, our national peak body for homelessness. Homelessness Australia, together with the Humair, are just delighted to welcome you all to our biannual National Homelessness Conference. Our last conference took place in December 2020 and we'd planned for that conference to be here in Canberra with the hope of a new federal government being in place with relevant policies with which we could engage. As it turned out, that did not eventuate, and that excellent delayed conference took place in the depths of the COVID-19 pandemic and was completely virtual. And how different are our circumstances today? Here we are in Canberra, eventually, and online, with a new federal government with whom we hope to partner to support the delivery of its commitment to an ambitious housing and homelessness plan. And we hope to be in a position to consult with you all right around the country to inform that plan. The past few years have shown what our sector can do. Around the country, we put people into hotels with each lockdown. We did our best not to put people back into homelessness at the end of each lockdown. We inspired state and territory governments to do more, and more they did. Homelessness Australia, together with you as a sector, successfully campaigned to see the National Partnership on Homelessness funding made recurrent. While we were in the depths of the pandemic, each year we worked as one and with partners to make sure that the former federal government continued to fund the ERO. We have kept up our Housing First training effort right around the country. Just last week, we launched our plan to end homelessness to provide the new government with a roadmap for change. I thank all of you who have contributed to the strong program we're going to enjoy this week. This program is all about best practice. It reflects international trends, examples from around our country, as well as our recent experiences. We are very fortunate to have with us today Auntie Serena Williams. Auntie Serena is a proud Ngunnawal Wiradjuri elder, a traditional custodian and a Canberra local. Thank you, Auntie Serena, for being here to provide us with a welcome to country.
Thank you for the introduction. For those that don't know me, which I'm sure is many here at this afternoon, my name is Serena Williams and I'm a very proud Ngunnawal Wiradjuri elder. I was born here in Canberra and reared here in Canberra, but also reared by my grandmother out on a reserve, a mission called 32 Acres, Cara, which is probably about 200 and something kilometres from Canberra, which still our mob is still living on. I'd like to acknowledge the Australian Housing and Urban Research Institute and Homelessness Australia for respecting protocols and having myself here today to do a welcome to country, to welcome you onto Ngunnawal land. Aboriginal and Torres Strait Islander people, we have the oldest living culture and we are the most resilient people in the world. And you know, when this come up, you know, about doing a welcome to country for homelessness, I was very passionate and inspired to actually be here today. And one of those being is that I've actually worked on the ground with my mob. And, you know, with Lifeline Australia writing accredited training for DV Alert to work with Indigenous people in Indigenous community around how to recognise, respond and refer to cases of domestic and family violence. And doing that through self-determination and making sure that I've done that culturally appropriately, because when you go onto one's land, you have to let people know your business there, and if they welcome you to come there, you can do that business. So I'm really happy to do the welcome to country today. Also with my extensive work with the Women's Legal Centre, founding and implementing the Mulliyan Mura program, for Aboriginal and Torres Strait Islander women and their families here, and a lot of the cases being around homelessness and DV, employment and health issues. So thank you for having me here today. I'm very proud to be standing in front of you as a Ngunnawal Wiradjuri elder and welcome you onto the lands of the Ngunnawal people. Yeramura, hello, come in. I will sweep the lands for you to leave your footprints on my country. Najan, the water from the Royal, the Murrumbidgee, the Monglo and the Gudjumbi, to cleanse you of all harms. And Malian. Malian is the totem of the Ngunnawal people. She is the wedge-tailed eagle. She will guide, protect and oversee you on your journey here on Ngunnawal country. Welcome, welcome, welcome. Welcome to the most beautiful country in the world, Ngunnawal country. Thank you.
Thank you very much, Auntie Serena, for that terrific welcome to country. And good afternoon, everyone. My name's Dr. Michael Fotheringham. I'm the Managing Director and CEO of the Australian Housing and Urban Research Institute, AHURI, and I also welcome you to the 2022 National Homelessness Conference. In a moment, we'll jump into the program with a ministerial address from the Honourable Julie Collins, the newly appointed Federal Minister for Housing and Minister for Homelessness and Minister for Small Business. Now, I know you're all on the edge of your seats waiting for the all-important housekeeping notes, but my introduction to the program and the housekeeping can wait just a moment, so we'll hold off with those until after the ministerial opening. I will start, though, with just a couple of important acknowledgements. I'm going to start by thanking you, the conference delegates. There are over 1,000 of you joining us for this conference, including more than 700 here in Canberra and over 300 joining us virtually from across the country and further afield. It's a true example of the new normal that we're able to benefit from this hybrid form of participation. To those of you here in person, welcome to Canberra. Thank you for your bravery in coming to the nation's capital in the middle of winter. And to those of you participating online, welcome to wherever you are. I'll also just take a moment to acknowledge some of our very important sponsors whose support has helped us deliver this conference and has assisted in keeping the registration fees as low as we can. Thank you to our two key government partners, the ACT Government through the Community Services Directorate as our host partner, and the New South Wales Government through the Department of Communities and Justice as our platinum partner. I'd also like to thank two other sponsors who've supported not only this conference, but also the National Housing Conference for many, many years. Mission Australia, who are sponsoring the bursary program, which is funding the attendance of delegates with lived experience of homelessness from all over Australia, and Community Housing Limited, who are sponsoring this evening's official welcome reception, where you'll have the opportunity to connect with each other over refreshments at the National Museum of Australia. Thank you to both organisations and to the many other sponsors and exhibitors who have supported this year's event. Now, it's no accident that Canberra is the setting for this year's conference, as we're all very eager to engage with the federal government on this really important topic. And as you're all aware, we have a new federal government following the May election, and with that comes a new minister with responsibility for housing, and importantly with homelessness as an explicit portfolio responsibility. That new minister is the Honourable Julie Collins. Minister Collins was previously the Minister for Housing and Homelessness in 2013, and since she was first elected in 2007, has also had ministerial responsibility for portfolios including community services and Indigenous employment, as well as a number of shadow portfolios and parliamentary standing committee roles, including roles related to families, community housing and youth, and infrastructure, transport and cities. So it's my pleasure to welcome the Minister to the stage for her first major address on housing and homelessness. Please welcome Minister Julie Collins.
Wow, thank you. Don't you all look wonderful out there and online? So many faces. I really appreciate the warm welcome. Thank you, Michael. I also too want to thank Auntie Serena Williams for her very warm and generous welcome to country. And I also too want to acknowledge the people on whose land we meet today, the Ngunnawal people, and pay my respects to elders past, present and emerging, and extend that to any Aboriginal and Torres Strait Islander people who are with us today, on those online as well. I'd also like to acknowledge the Australian Housing and Urban Research Institute that we all know and love as AHURI, and Homelessness Australia, more broadly for hosting this very important conference today. To Ahuri and the Managing Director, Michael Fotheringham, thank you for your ongoing contribution to housing and urban research and for your major role in ensuring that evidence is used and has a prime place in policy making in Australia. And to Homelessness Australia and Chair Jenny Smith, thank you also for your pivotal advocacy on behalf of the homelessness sector and for your dedication to changing the lives of so many valuable Australians, vulnerable Australians. It is also through both research and perspectives put forward by organisations such as Ahuri and Homelessness Australia, and so many of you who are in here today, that society can achieve a rounded view of homelessness in this country and the solutions we need to combat it. We all know that housing and a sense of home is a basic human need, and that housing is fundamental to the well-being of all Australians. We also know that access to safe, affordable and sustainable housing has a profound impact on an individual, improving their social, health, employment and education outcomes. I'm sure many of you have seen that in the work that you do every day, and I have seen it already in my short time in this role. As you know, last week was Homelessness Week. This annual event puts a spotlight on the impact of homelessness in Australia. It was discussed in the Federal Parliament last week and out and about in communities right across the country. This year's theme was to end homelessness, we need a plan. Well, I'm very pleased to say that the federal government now wants to have a plan. Indeed, we want to work on it with you. As highlighted last week, homelessness continues to be one of the greatest social and economic challenges that we face in Australia in 2022. The situation has only been exacerbated to be one of the greatest social and economic challenges that we face because of COVID and, of course, because of natural disasters. We've had far too many. Homelessness has many faces and comes in many forms, from overcrowding to couch surfing, those that are in emergency supported accommodation, or those sleeping rough in tents and in cars. And the reasons why people become homeless, as you know, are as diverse as they are complex. We all know that some of the leading causes of homelessness, or people being at risk of homelessness, are women and children impacted by family and domestic violence, people with mental health conditions, drug and alcohol issues, or financial difficulties. And of course, we all know those awful statistics. According to the Australian Bureau of Statistics, 116,000 people were homeless on census night in 2016, up from the previous census of 102 in 2011. And of course, we're all expecting the data release next year of the most up-to-date census figures. And sadly, I think we're going to see it increase again. Indigenous Australians are over 7 times more likely to experience homelessness, largely due to severe overcrowding, particularly in remote Australia. Older women experiencing homelessness are the fastest growing cohort, increasing 31% between 2011 and 2016. Older men experiencing homelessness increased from around 9,300 in 2011 to 12,000 in 2016, an increase of around 26%. And men, of course, account for 63% of older people experiencing homelessness in 2016. We all know these statistics are shocking, but these are people behind the statistics. They are individuals who have a right to have safe, affordable homes. I was pleased to go and visit Wintringham in my own electorate just last week to have a morning tea and to meet with some of the residents who have recently been housed. Many of you from Victoria will know the wonderful work that Wintringham does. It's an innovative solution, providing high-quality care and accommodation for older Australians using the aged care system. And it's really quite a wonderful thing. But it's also important to hear the stories of those people who are impacted, to know why we're all doing this. It's a great project and it's going very well, and I look forward to going back as we get more people homed in the facility. We also know newly arrived migrants and young people continue to be overrepresented in homelessness statistics. Both cohorts are far more likely to experience severe overcrowding and couch surfing. The Reconnect program, which I'm sure many of you are familiar with, is one of the ways we're seeking to address and reverse the trend of more young people becoming homeless. Reconnect is a community-based early intervention and prevention program for people aged 12 to 18 or 12 to 21 in the case of newly arrived young people who are homeless or at risk of homelessness. The aim, of course, is to prevent homelessness by intervening early with families and young people to stabilise and improve the young person's housing situation and improve the level of engagement with family, education, training, employment and local communities. At the moment, the program is helping around 7,700 young people each year to improve their relationships with their family, stay at school and to participate in their local community. I had the pleasure just a few weeks ago of visiting Rosebery Community Services in Gladstone to see the wonderful work that they are doing and to talk to the providers and the General Manager, Michelle Coates, about the program and how it's improving lives of local people. I want to commend Michelle and the team in Gladstone at Rosebery for the work they're doing, like I want to commend all of you in the room for the work you do day in, day out. Moving back to the numbers, the Australian Institute of Health and Welfare Specialist Homeless Services annual report paints a picture of who is using services at the moment. In 2020-21, 28% of homelessness service clients were Indigenous, 38% had a mental health condition and 39% were experiencing family and domestic violence. Over 3/4 of clients accessing services for family and domestic violence services were female, and 60% of all clients were also female. Women were the main recipients of specialist homelessness services, and financial difficulties and family violence continue to be among the most common reasons for people seeking these services. I've also recently visited the Hobart Women's Shelter and saw firsthand the great work that they are doing to help provide safe emergency accommodation and to support women and children who are impacted by family violence and those who have become homeless more recently. The shelter will soon be celebrating 50 years in 2024, and it's the second oldest shelter in Australia. However, it still has to turn away significant numbers of women and children, which is an indication of just how challenging the situation has become. The Albanese government has committed to a comprehensive housing agenda. We want to bring national leadership back to housing and homelessness. We want a strong focus on stable and affordable housing for all Australians. It's one of the reasons that we've put the housing and homelessness portfolio back into Cabinet. As you heard from Michael, I'm not a stranger to this position. I was in the position briefly in 2013, and can I say how wonderful it is to be back. Homelessness is an ongoing challenge for the government, and it's one we take very seriously. It's why in 2022-23, we continue to invest around $5 billion in the Commonwealth Rental Assistance Program to help eligible Australians pay their rent in the private market or in community housing, and why we'll also continue to invest in the National Housing and Homelessness Agreement with $1.6 billion to the states and territories each year. Collaboration is the key to addressing the homelessness challenge in Australia. Whether it's states or the sector or local government, we need to work together. Events like this national conference provide a forum for people to come together and share ideas about how we can tackle the issues before us, to talk about the innovation and provide opportunities for us to listen and learn from each other. The federal government is also committed to working collaboratively across all levels of government to make it easier for Australians to access safe and secure housing. We had our first Housing Ministers meeting, you may have seen just a few weeks ago. It was the first in almost 5 years to discuss how we can work together on housing and homelessness challenges across the country. At the meeting, we talked about the Commonwealth's key housing and homelessness priorities, and we saw early input from the states on their work and their investments and their innovations. It was really encouraging. The states were terrific. They were talking to us about what is going on in their communities, and they're willing and ready to share the innovation with each other, but also importantly the data so that we can work on the evidence about what works. We also talked about priorities, challenges and housing strategies, providing key insights including how the new federal government's initiatives will boost and leverage the recent investments that some states and territories are currently making. Some of the states and territories have made significant investments. Indeed, I calculate that from 2021 to 22 through to 2024, around 15,500 social homes will be added to Australia by the states and territories. When we talk about Federal Labor's plan, we're talking about homes on top of this. It is great progress, but as we know, we need to do more. We do know that states, territories and local government also hold many supply levers. Therefore, a strong relationship across all levels of government is critical to achieving our aim to build 30,000 additional and affordable dwellings under the Housing Australia Future Fund. But the meeting with the states and territories was also a key opportunity to seek their views about a national housing and homelessness plan and the re-establishment of a national housing supply and affordability council. We've committed to establishing a council to support the Commonwealth leadership role in increasing housing and supply and improving housing affordability. The National Housing Supply and Affordability Council will be comprised of experts from a diverse range of relevant fields that could include, but not limited to, finance, economics, urban development, residential construction, urban planning and the social housing sectors. We want everybody working together. The Council will also play a key role in the development and implementation of one of the key pillars of our housing and homelessness agenda, the National Plan for Housing and Homelessness. We really want to work on this plan in collaboration with all of the stakeholders. That means state and territory governments, as I said, local government, not-for-profit, community organisations, industry bodies, superannuation funds and other experts in housing, finance and urban development. I hope that many of you, as Jenny said, will get engaged in the process. Close collaboration between the government and the state and territory governments will be critical in developing and implementing a national housing and homelessness plan. And I'm pleased to say that at our meeting, ministers agreed to progress this reform. The plan will be informed by advice by the new council and will set out short-term, medium-term and longer-term reforms needed to improve housing and homelessness outcomes right across the spectrum. A key aspect of addressing the availability of housing for vulnerable Australians is to boost social and affordable housing. Indeed, that's why we want to have the Housing Australia Future Fund, $10 billion. In the first 5 years of the fund, 30,000 social and affordable properties to be built. Each year, investment returns from the Housing Australia Future Fund will be used to fund social and affordable housing projects. In the first 5 years, we also want to use the investments to invest $20 million for the repair, maintenance and improvements of housing in remote Indigenous communities, $100 million for crisis and transitional housing options for women and children fleeing family and domestic violence and older women on low incomes who are at risk of homelessness, $30 million to build more housing and provide more specialist services for veterans at risk of experiencing homelessness. Of the 20,000 social housing properties, 4,000 will be allocated for women and children fleeing domestic and family violence and the older women on low incomes who are at risk of homelessness. And the 10,000 affordable homes will first be allocated to frontline workers such as police, nurses and cleaners. We want to make sure that people can get the homes they need to make sure communities have the services they need. Our Help to Buy program is a shared equity scheme that will allow 10,000 home buyers a year to buy a new or existing home with an equity contribution from the government. We've committed to providing an equity contribution for a maximum of 40% for the purchase price of a new home and a maximum of 30% for the purchase price of an existing home. This will benefit eligible home buyers with a smaller deposit and will result in smaller mortgage payments and a smaller mortgage overall. The Regional First Home Buyer Support Scheme is another program to help 10,000 first home buyers a year in regional Australia to buy a home. This scheme will provide a government guarantee of up to 15% of the purchase price of a home for eligible first home buyers and will enable eligible applicants with a 5% deposit to enter the housing market sooner. So we have a suite of policies right across the spectrum to try and deal with the housing and rental affordability challenge. But if I can leave you with one in Canberra and in the government. The last decade of drift and disinterest in the housing and homelessness policy is over. Almost a decade of housing policy inaction at the federal level has left the new government with some serious challenges, which I've highlighted today. But the work of fixing these challenges is difficult. We cannot turn it around overnight. But I will not let this be an excuse for inaction or an excuse not to be ambitious about what we're doing. The government recognises the task of ensuring every Australian has a safe place to call home is not just someone else's job. The task is not just a job for the states and territories. The task is not just a job for community housing providers or for local government. It's not just a job for the private real estate market or for homeowners and rental owners. The task of ensuring every Australian has a place to call home is a job for all of us, everyone, working together. It's important that leadership starts at the very top. And I'm pleased to say that the Albanese Labor government is ready to provide this leadership. I look forward to delivering on the policies that I've talked to you about today, and I don't see this as our government's only leadership role. Real leadership on this issue will require us to reframe the conversation about Australians that are facing housing challenges. These challenges are happening in the suburbs and neighbourhoods of the cities and towns right across the country. This is no longer an issue for just a few of us in society. This is no longer an issue that is happening in someone else's backyard. It is happening in all of our backyards now. We all know somebody being impacted by the rental affordability issue or the housing affordability issue. As the Albanese government goes about implementing our policies, including delivering more social and affordable housing across the country, I'll keep reminding Australians of this. We need this social and affordable housing in every community. And safe and affordable housing is central to the dignity of all Australians. We all benefit when everyone has a safe place to call home. It's critical to ensuring the opportunity is shared equally in our country. It's a springboard to a better life for so many. The Prime Minister knows it because he has lived it. I know it because I have lived it. It's a long journey from public housing in Camperdown for the Prime Minister to his new public housing at the Lodge. But in a wealthy, prosperous nation like Australia, no one should be denied this opportunity. There are still far too many people that don't have a stable or secure home and struggle to keep a roof over their head. Too many people who are on the edges of our society and in our communities. The government has an ambitious agenda to make a difference to Australians struggling with housing affordability. I've outlined for you today some of the activities we intend to undertake as it relates to national leadership, collaboration, the housing supply to shift the dial on the experience of homelessness in Australia. But for now, I want to wish you well over the next few days as you come together and you share insights and expertise and seek to learn from each other. And I want to say thank you for giving me the opportunity to be with you today. And I look forward to working with all of you on our National Housing and Homelessness Plan. Thank you.
No, I think we're well behind. Thank you. Thank you very much, Minister Collins. We especially appreciate you joining us today after the conclusion of two very busy parliamentary sitting weeks, the first two sitting weeks of the new government, and certainly very busy agenda over the last couple of weeks and continuing this week for you. We also have a busy week this week, so I'll jump straight into that housekeeping you've been waiting for, and then we can get into the first panel discussion. So let's just begin by acknowledging our commitment to being COVID safe. Although we do seem to be past the peak for the most recent wave, there is still the need for us all to be diligent, and that does mean that although masks are not mandatory, they are still encouraged, particularly in the crowded spaces where you can't socially distance. So I would encourage you to use a mask and to consider using a mask all the time. We do have some available at the information desk if you don't have one or if you lose one. We've also arranged nice big conference rooms for all of the sessions, and I'd encourage you to take advantage of that, to spread out, to make use of the space that's here for us. We're also mindful of hand hygiene, so there are sanitiser stations throughout the conference venue, and we have the whole venue to ourselves. We're not sharing it with any other conferences, so take use of the space we have. And of course, if you wake up one morning feeling unwell, please stay home and join us virtually instead. The emails that you will have received yesterday and again this morning will cover how to do that. You'll all have received those instructions, so along with the QR codes you use to check in, there are instructions for the virtual attendance. A couple of other quick pieces of housekeeping then. Use the conference app. The instructions to download the app as well as the venue Wi-Fi details are on the screen right now. Search for the Events Air app in your preferred app store And through that, you can see the conference sessions, the lineup of speakers. You can choose your own program to work out where you're going to be for each session through the conference. Really give you a curated experience. We'd also encourage you to use the app to give session ratings at the end of each session. We do look at that feedback and consider how to improve the conferences each time, so please give us ratings on the sessions you find useful and the others. Lots of other features on the app. I won't go into exhaustive detail, lots of networking opportunities and so on, so explore that at your leisure. Finally, I'll just take a few moments to run you through a few key highlights of the program. Against the backdrop of the profound challenges of the last couple of years, there's a lot to cover in this year's program, from the ongoing impacts of the global pandemic to the devastating and seemingly more regular natural disasters across the country, to the cost of living crisis. All sorts of events are creating new challenges for Australians, and those challenges are even more devastating for those who are homeless or at risk of homelessness. So with that in mind, the conference tackles those big issues and drawing on the amazing knowledge and experience of the people assembled here, looks to the solutions that we can find and encourages our policymakers and politicians to lead and enable those solutions. As we've just heard, there's a new federal government with clear commitments and a willingness to engage. And there have been positive responses to address homelessness during the early stages of the pandemic, and a number of those are continuing today. These issues form the basis for this afternoon's opening plenary session. Tomorrow we'll hear from First Nations leaders about programs across the country to reduce Indigenous homelessness, and then we'll learn about the impact of a national homelessness strategy in Scotland, something that we might draw from in shaping the plan in this country. And then on Wednesday, we'll close the conference with lessons from perhaps the largest public media campaign on homelessness this country's ever seen. Beyond those plenary sessions, though, the program unpacks many of the on-the-ground issues that many of you deal with day to day through 15 separate concurrent sessions. There's a vast array of topics. I'm not going to try and summarise them all, but I did want to make the point that many of those sessions throughout the 3 days have been guided, informed and are being delivered by people with lived experience. Now, in terms of program logistics, our plenary session and the major concurrent sessions are all live streamed, so our virtual delegates can see those, and they'll be recorded and available to all of us afterwards. And during each of the concurrent segments of the program, 3 sessions are live streams and will be recorded. They're indicated in the Pocket program and in the app, so you'll be able to tell which ones are available for virtual attendance or for watching later on. For those of you here in Canberra, we do encourage you to take advantage of the important networking opportunities through the social program. Starting tonight, we kick off with our official welcome function at the iconic National Museum of Australia. It's proudly sponsored by Community Housing Limited. The buses will transport you from here to that venue, leaving from outside from 5:30 until 5:50 today, and we'll bring you back afterwards. And tomorrow, our morning tea, lunch and afternoon tea breaks will be held across the foyer in the exhibition precinct. It's a really large space that's been set up to allow people to move around. I'll provide more instructions about that a bit later on. And for the early birds, we thank you for booking into the breakfast event on Wednesday morning. It's a very early start. In conversation with 2 newly elected representatives, Independent Senator for the ACT, David Pocock, and the new housing spokesperson for the Greens, Max Chandler-Mather. Should be a terrific morning. It is an early start, but the coffee will be warm, so it will be there. Now, in a moment, Jenny Smith from the Council to Homeless Persons and Homelessness Australia will take the reins to facilitate the opening panel session. So, over to you, Jenny.
Am I allowed to start? Thanks heaps, Michael. Before I begin, could I again acknowledge that we're meeting on the land of the Ngunnawal people and the traditional custodians of this land, and that I pay my respects to elders past, present, emerging, any of who we have here with us today, and acknowledge that not any of these lands were ever ceded. I'd also like to acknowledge the generous support of the New South Wales Department of Communities and Justice as the sponsor of this particular concurrent session, and that department, of course, is also the platinum partner of this conference, and we really value and appreciate this vital partnership. So from the 25th of January 2020, much of what's been going on in our world, at least politically, economically and socially, has been driven by the impact of COVID-19. COVID-19's affected us all as individuals. We all have our own experience about how it's impacted our life trajectories and that of our nearest and dearest. The experience wasn't uniform all around the country. We can juxtapose the experience of Victoria, locked down for more than 9 months in total, with the relative freedom in WA. State and territory governments, immediately or eventually, understood that isolating safely required access to accommodation, and hence the advent of the COVID hotel or equivalent to longer emergency accommodation. As a sector, early on we were pretty excited to be able to offer rough sleepers a quality crisis accommodation option for a change. That does seem a long time ago now. We saw an unprecedented scale of coordinated responses between government, our sector, and the broader community sector. In the 9 months, March to October 2020 alone, more than 40,000 people were housed in emergency accommodation, predominantly in South Australia, Victoria and Queensland, and a great deal more emergency accommodation followed. I think a complication for us all is that this activity gave some community members the idea that homelessness had been solved. As time wore on, our excitement was dashed by the heartache of asking people to leave hotels too often back into homelessness. As time passed, as a sector, we were worn down. As time wore on, some state and territory governments understood, perhaps better than they had before, the level of complexity and disadvantage amongst those being housed in hotels or equivalent. They understood that longer term responses were required. And again, as a sector, a very tired sector, we rose to the challenge of implementing those initiatives. And so to our session today. We're going to hear from 4 jurisdictions about what has been done, what has stuck, and what should be taken to scale nationwide. We will hear government perspectives from our 2 biggest states, New South Wales and Victoria, and we will hear 2 sector perspectives from the ACT and South Australia. So I will introduce each of our 4 panellists in turn, and each will address you. And after that, we'll ask them to retire to these seats, and all going well, we should have a good half hour at the end for you to ask panellists your questions. So that might be started a bit late, so it might be a bit shorter than that. So don't hold back. We'll have roving microphones around the room. So if you want to ask a question, put your hand up and I will shade my eyes and find you. And we need to use the microphones because this session is being recorded for those online and posterity, and we'll need to make sure that you're included in that recording as well as heard by the people here. If you're online, also don't hold back. I've got an iPad here where your questions, and you can do it from your apps in the room as well. Ask your questions through the chat and the Q&A tab to the right of your screen. For those of you online, should be make it easy if you ask that question. If you would like to know more about our speakers, fuller bios can be found on the conference app. So to bring you our first government perspective, it's great to be able to introduce to you Ben Rimmer, who's the inaugural CEO of Homes Victoria, which is the new Victorian government agency responsible for social and affordable housing and homelessness. Ben transitioned to that role having been Director of Housing since December 2019 and integral to Victoria's commitment to the $5.3 billion Big Housing Build COVID stimulus initiative. Ben's undertaken a number of very senior roles within the Australian Government, Victorian Department of Premier and Cabinet, and he has been the CEO of the City of Melbourne. Please join me in welcoming Ben.
Thank you, Jenny, and it's great to be with you all here today. I'd like to join the other presenters in acknowledging Aunty Serena and the traditional owners of the Ngunnawal lands, as well as acknowledging the First Nations people in the housing and homelessness systems right around the country who've done such an extraordinary job, in particular through the COVID pandemic, but also just more generally. And their incredibly important work in working with us all to overcome the overrepresentation of First Nations people in homelessness. It is great to be with you all here today at the conference. It's awesome that Ahuri, Homelessness Australia have combined forces to take this opportunity to reflect, to consider, to plan, to network, to agitate, and all the other things that Jenny will do before this evening's out. And the rest of you as well. I am very proud to be the first CEO of Homes Victoria. It's a very strange sound, by the way. I don't know whether it sounds okay out there. It's kind of weird. Homes Victoria is, as Jenny has said, the new Victorian Government agency tackling homelessness, building lots of social and affordable housing, taking on, I guess, the best traditions of the Housing Commission of old, or the Office of Housing or other institutions, but also bringing it into the 21st century and adding a lot of capital, a lot of energy, a lot of reform drive. And as a very great pleasure to lead it. Victoria was hit hard by the pandemic. Despite the many challenges, I'm very proud of the groundbreaking initiatives in preventing and reducing homelessness during this time, and many of you in the room have been part of that, and I'm very grateful to you for it. We did provide very large-scale emergency accommodation through hotels. I'll talk more about that. We did get into the From Homelessness to a Home program, which many people in the room will have been involved in, and also the Homes for Families program more recently. I did want to provide a bit of an overview to our response, all of which started from the overriding premise of protecting people experiencing homelessness from the worst ravages of COVID-19, particularly at the time where we had so little protection as a community before vaccines. We have been pretty involved in vaccinating, but also to try and grab the crisis moment and get on a better path and a better trajectory in relation to housing and homelessness. But first, a bit of a cook's tour of some views on this topic, because I think people like cutting to the chase. We do know what it takes to end homelessness. We do know what it takes to end homelessness. It does start with a plan, as the Minister has said, as Homelessness Australia said. It does require a hell of a lot of additional social housing. And I do think it is important to recognise the importance of the sheer supply of social and affordable housing in addressing homelessness. It does require support to sustain tenancies. It does require effective navigation services. It does require good integration across services, particularly Commonwealth, state, local. It does require a really solid commitment to self-determination. It does require income support, both policy and practice, NDIS support similarly, aged care support similarly, that actually works for people experiencing the highest levels of complexity and social disadvantage. We also know that there are some things often in the media that have the potential to steal oxygen, that destroy our focus, both within government and within the sector, and waste resources. Because we know what it takes. We don't actually need huge numbers, more trials and one-offs. We don't actually need silver bullet solutions from the commercial world. We want to work more effectively with the commercial world in building social and affordable housing, but we don't need commercial leaders telling us that if only governments were a bit more intelligent and had a particular idea that they've thought up in a working group, that would solve the problem. We don't need random acts of one-off philanthropy, much as they're welcome and much as they're valued. What we need is systemic and structural solutions to tackling housing and homelessness challenges, and we need a plan integrating it all and bringing it together. Advocacy sometimes, media often, sometimes do focus on the wrong issues. And in my role, I'm constantly frustrated, as I'm sure many of you are, at the willingness of some in the media to miss the point and to focus on the wrong issues. We should, as a group, be tough on this. We should call it out because we need structural change. We don't need confetti. We need national shared integrated policy of the kind that the Minister was talking about, of the kind that housing ministers in a bipartisan way right around the country agreed to pursue on the 30th of July with new Commonwealth leadership. It takes bravery, but it's achievable. From a Victorian perspective, I know we have a government that's been taking bold and brave steps in this direction. We have a national government that's showing a willingness to do the same. I actually think it's foreseeable, perhaps more foreseeable than ever before, that we could see national agreement to reduce homelessness significantly, or perhaps even substantively eliminate it, and make homelessness, as the saying goes, rare, brief and non-recurring. A little bit of background. So this is a slide which shows Victoria's emergency hotel accommodation over, I think it's 6 lockdowns, isn't it? And the very significant growth and continuation of emergency accommodation through this period. I would personally like to acknowledge the incredible work of the sector, of the workers throughout this period, and give my thanks to that. I firmly believe that this work has saved lives. I firmly believe that this work has changed many thousands of Victorians' trajectory in a good way, despite the challenges of the COVID pandemic. About 105,000 people sought support from homelessness services in Victoria in 2021, and about 8,000 of these were identified as people sleeping rough. And I'll come back and talk about how that's faring now. When the crisis hit, these were people with no home to isolate in as the virus and fear spread through the community. We quickly engaged with partners in the homelessness sector to collaborate on solutions to these challenges. In fact, I think that on the 18th of March, the Victorian Government published a media release on homelessness and COVID with Sherry Brunhard's leadership, who's here in the room. It was the first non-health media release on COVID from the Victorian Government, something that I think Sherry and the team should be very proud of. And a huge number of rough sleepers ended up in emergency hotel accommodation. At the peak, we had 3,000 people accommodated in hotels. The famous ones, perhaps infamous ones, were in the centre of Melbourne, but these were hotels right across Victoria, in regional centres, in rural towns and in the city. Between the 16th of March 2020 and the 31st of January 2022, over 30,000 hotels were provided with emergency accommodation. So in about a little over 18 months, and over 1.4 million nights of hotel accommodation were provided, which is just an awe-inspiring figure, really. And of these households, 28% were sleeping rough before they attended the hotel, and many of this cohort were extremely complex, had extreme levels of trauma, disadvantage, and a long history of sleeping rough and engaging with a whole variety of services. Through this period, there was a whole heap of innovation and investment. The homeless hotel's emergency response itself was an innovation. The homeless emergency accommodation response teams, Hutt, were established in locations right across the state, and they did a massive job in coordinating emergency accommodation and support. There was a huge amount of collaboration on data. There was a huge amount of collaboration on the complex needs and high health needs of the cohort in hotels. Lots of focus on COVID prevention, health promotion prevention, security, working with the health sector to keep people safe and well. And from my perspective, what I saw was a sector and departmental staff literally engaged in person by person, well, combat's probably the wrong analogy, but to desperately try and keep COVID out of this context, because we knew that it would be so devastating if it did get in. And for a long period of time, we did succeed in achieving that when the COVID zero policy was a thing, until I think it was pretty much the end of September last year, where COVID zero no longer became possible. But there was a huge amount of effort literally at preventing every single infection, every single outbreak right throughout that period. There was also a huge amount of effort on vaccination. Over 3,000 COVID vaccinations delivered effectively in hotels during this period, and obviously an important part of that to a very vulnerable cohort who may not have been vaccinated in other places. The COVID isolation and recovery facilities, affectionately known as SIRFs, were an incredibly important response for very, very vulnerable members of the community throughout that period, and still in place today. Sector partners including Anglicare, Brotherhood of St Lawrence, Launch Housing, Sacred Heart Mission, Vincent Care Victoria, St Vincent's Hospital, all working together to create an incredibly strong clinically led response to COVID infection and risk within very vulnerable communities. And I might say that facility was also incredibly important, not just for people currently experiencing homelessness, but for all members of the community experiencing significant vulnerabilities if they were at risk of COVID or had in fact been infected with COVID. Of course, the second wave of the innovation and investment was two big programs, From Homelessness to a Home and Homes for Families. From Homelessness to a Home is currently housing a little over 2,000 Victorians. It is a real effort at housing first as a response. It is the combination between a home and some pretty significant support. And it is a pathway to long-term engagement in stable, safe housing for a cohort of people, in many cases, who haven't experienced that for a long time. One of the absolute pleasures of my job is I get out and about and I get to meet a whole range of people, including people who are part of the From Homelessness to a Home program. And it is awe-inspiring, the change that has happened in many thousands of Victorians' lives as a result of the program. And I know that everyone in this room will understand that well, because it's an important part of the work that many people in the room do. And it was enabled by the incredible work of community partners, the very difficult work of community partners. It was not a program without its challenges. It had some incredibly intense challenges at various moments of it, but a huge amount of very strong and capable professional work by community partners and by community partner staff throughout that whole period. It's worth noting that about 18%, a little over 17% of the cohort in this program were identified as Aboriginal and Torres Strait Islander, which really just goes to show the enormous overrepresentation of First Nations people in the very vulnerable, complex, rough sleeping cohorts. Finally, the Homes for Families program was announced most recently. This was towards the end of the pandemic. Basically, the service system was full. We knew we couldn't bring another couple of thousand clients into the Homelessness to a Home program. The whole system was basically full, but we did know that we had about 150 families, about 400 children still living in the hotels. And I just encourage you to think about people who were still involved in hotel accommodation in October 2021, so this is a good 18 months into the COVID pandemic, in many cases had been in and out of hotels for that entire period, and many of those children were in very large families, some as large as 7, 8, 9 kids, many single parents, and huge degrees of complexity and trauma in that cohort. Again, a significant component of that group as Aboriginal and Torres Strait Islander families, and another significant component as migrant or refugee families. All of this took place alongside the big housing build. The first properties in the big housing build are now online and are now occupied in many cases by people who were part of the the Homelessness to a Home and Homes for Families program, which is exactly as it should play out. You can see in this chart, this is from the SHS data. It's early days. There's no mission accomplished signs going on anywhere around Sherry's office yet. But you can see that we have successfully kept rough sleeping numbers down through this period. You could argue that there's the early signs of a decline in rough sleeping as measured by the homelessness service system. There are other things going on through this period, including the pandemic, but I think there is starting to be some evidence of success through the program that is of very great relevance to the Treasury, to the Treasurer through the Early Intervention and Investment Framework in terms of reducing both the human harms of rough sleeping and the trauma caused by rough sleeping, but also the downstream costs to other service systems that the Treasury and the Treasurer are concerned about as well. Through all of this, a huge focus on collaboration and a real sense of partnership with the sector. No doubt we'll hear more about that over the next couple of days. It hasn't been perfect. There have been moments that have caused frustration to all of us in this period, but I reckon in the middle of a global pandemic that we've never seen before, actually the sector and the team have done a pretty good job at working together on the stewardship front, on the collective impact front, on the flexibility and agility front. I mean, we have literally had to do things in hours during this period that would previously have taken, well, years in some cases, and that has required a huge degree of trust, of agility from the sector. So some lessons learned. I think we have learnt that it's possible. I think we have learnt, not to Jenny's point earlier, that it's solved, because it's not, but I think we have learnt that it's possible, and I think we've rekindled a view, certainly in Victoria, that you can actually have a significant and substantial impact on rough sleeping and other forms of homelessness. We've adopted a data-driven approach. We've tailored supports to individual circumstances. We've really doubled down on housing first as a mindset, as a methodology. Not perfectly, but we're getting there. We have seen additional investment in homelessness that's flowed from this. In the 22-23 state budget, the Victorian Government invested another $75 million to support reform of homelessness services, and we're working very closely together with the sector to do what I think we all want to do, which is to improve the way we spend the money that we have for social housing and homelessness, and to improve the effectiveness and efficiency of that spend. We have learnt a lot through the big housing build more generally about how best to grow social and affordable housing rapidly. We've also learnt a lot from the high-risk accommodation program which was a direct COVID response in terms of keeping people healthy and safe and connecting people more effectively to the health system through the social housing system and the homelessness system, the supported residential services sector and the disability sector. And as a result of that, we now have some ongoing funding in a program called the Community Connectors program, which is effectively a community health program designed to increase health literacy. So all of that has been a remarkable body of work by a very large number of people, many of whom are in the room. So if I can go back to an earlier comment and just to say a massive thank you on behalf of Homes Victoria to everyone who's been involved in this response, because it's been a truly superhuman effort by literally hundreds and thousands of people, and it's very much appreciated. Thank you very much.
Ben, I'll get you done. Thanks, Ben. Thanks for that masterful overview of the work that you, who worked as long and hard as anyone, and Victoria undertook in its Victoria's COVID response work. And I look forward to hearing a bit more about it in the discussion. So our second government perspective is from New South Wales, and with us is Humair Ahmad, who is the Director of Community Housing at the New South Wales Department of Communities and Justice. Humair trained as an architect and planner, and his involvements to date include the Social Housing Management Transfer Program, Community Housing Innovation Fund and Together Home. He's also worked on the Asset Vesting Program and more recently helped design the services stream of the Social and Affordable Housing Fund. Humair oversees the delivery of a range of crisis and transitional housing, private market, head leasing and affordable housing programs. Please join me in making Humair feel very welcome.
So good afternoon, everyone. I too would like to acknowledge the traditional owners of the land on which we meet today and pay my respects to the elders past, present and emerging. So I might click on that's the click, yeah. Oops. I obviously can't, I'm technologically challenged, but I'll move on to the next slide. There it is, no? I think I'll need your help, Jenny. Oh, maybe it's that button up there. Is that?
I don't know.
Oh, Ben,
What about the green one in the middle? What about?
Oh, the green one.
Yeah.
Okay, perfect.
It's green for go. You know.
Okay, perfect. I'm blind as well. Okay, so I'll move on to the slides and start with the contextual one, which is what triggered the response in New South Wales. As you all know, the response was triggered by health orders, which required people to self-isolate, and a recognition by the government that one of our most vulnerable populations would be unable to socially isolate and practice social distancing. And they were our street sleeping population, clients who are in refuges and congregate care facilities. And we needed a rapid response. And as you all know, bringing new social housing supply online is very difficult and takes time. So the obvious solution was to look at market solutions, private rentals, and vacant hotel accommodation. And very similar to what Ben did in Victoria, there was an immediate rapid response to house people in hotel accommodation. We also realized that the inputs from government needed to happen across the whole housing continuum, not just on the crisis end. We needed to sort of bring forward some supply, and state government agencies and community housing providers were funded to bring forward some supply. And we looked at the whole spectrum of initiatives, all the way from crisis and social housing to private market initiatives. The distortions in the private market were a bit of a help and a hindrance. Again, because of COVID, as you all know, and border closures, there was a lot of vacant accommodation and holiday rentals and other properties that were lying vacant. So a lot of our inner city, especially providers, were able to access those very quickly. But then it had a flow-on effect in the regions where a lot of escapees from the cities, again, caused a lot of market chaos in those areas, and we sort of faced problems later on in the pandemic. So this fairly busy slide is quite busy because it kind of tries to encapsulate all of the initiatives that New South Wales, at least the key ones, tried to establish during the COVID period. I've categorized them into a few key areas, but I'll spend more time on the housing programs. So very similar to what Ben said, sector collaboration was a major thing that we wanted, and our existing programs obviously have that element in them already, but in the face of a crisis, we did want to bring together all partners. At a program level, there was various governance structures set up, but in the inner city, the Rough Sleeper Task Force was set up, which brought together Council, Homelessness Services, Speaks, New South Wales Health. Again, it was an attempt to pool resources, bring together services to make local decisions, innovation, and also having clear, consistent messaging. The other thing that we did was sector support. As is true for most jurisdictions, we have a very vibrant community housing sector and specialist homelessness services sector. And we wanted to make sure that the most recent information was provided to them in a timely fashion. In fact, I think we probably did a lot of information overload, but during the earlier days of the pandemic, we did provide a lot of information, distilling health information and providing it in simple terms, guidances, training on how to run a safe service. That was also followed by providing practical assistance in terms of personal protective equipment and further on RAT tests that were available when national stockpiles were available. Another initiative that we did was cleaning of our congregate care facilities and crisis refuges. That too, I think, not only did it engage our cleaning sector, which was suffering because of office closures, and supported them economically, but also prevented a lot of outbreaks in those refuges. And this cleaning was on top of the regular cleaning that happens. And of course, deep cleaning was also done on a regular basis. I would want to focus also on client engagement and support funding. Now, we already had a fairly well-established outreach program, which engaged with street sleepers on a regular basis. It was mainly active in Newcastle, Sydney, and Tweed, but that was expanded to 58 locations because of the pandemic. And as a result of that, there was engagement of an otherwise quite difficult to engage client group, encouraging them to move into hotel accommodation. And also a lot of support was wrapped around to the Step to Home program to sort of help them stay in hotel accommodation and engage with services. In terms of support generally for particular client cohorts, there was additional support for women escaping domestic violence. As we all know that because of lockdowns particularly, there was an increase in incidences of domestic violence, and the government acknowledged that. And further funding was provided. Both Commonwealth and state funding was given to the sector to support that particular client cohort. We also provided further funding for homeless youth and unaccompanied children and young people under 16 in homelessness services in response to the COVID requirements. Another vulnerable cohort that we identified was non-residents. As you all know, a lot of those non-residents do not qualify for any government assistance, and during COVID were suffering significantly. Funding was provided to specialist migrant and settlement services, supporting temporary visa holders. The funding provided temporary visa holders with access to food and supplies and medical support, telecommunications, transport, and essential housing. So Let's get to the housing programs. And very similar to Victoria, we also implemented a major housing first program called Together Home. Now, Together Home started off as a small program, not small, but 400 housing and support packages. It was centered on the private market because, as I said in the first slide, we had to sort of bring supply very quickly. It was around leasing subsidies for 2 years for clients and a lot of support funding. And there was also an aspect of high needs funding for our particularly vulnerable clients. And that program, of course, expanded very rapidly from initial 400 housing and support packages to now nearly 1,070 housing and support packages with around 800 clients housed through the program and more than 900 receiving support. If you look at all the clients that may have had a touch point with the program, you're looking at more than 1,100 clients that have actually been supported through the program. Now, an interesting fact is that we were able to stand up Together Home within a few weeks. And the reason for that was that we had a long history of doing housing first programs. We had Platform 70, Housing Connect, STEP. A lot of these programs were already there. We had the required infrastructure in place. We had contracting arrangements with community housing providers. We had a very, very large leasehold program. We leased nearly 6,000 properties from the private market through community housing providers. So we had all the infrastructure set to go. And then, of course, we had a very, very willing and able community housing sector who could just pick up and run with the program. And we were very proud of the fact that we were together with our community partners and specialist homelessness services and community housing providers be able to stand up the program. Now, in subsequent tranches of the program and based on feedback from the sector, it became very clear that beyond the 2-year funding available for leasehold subsidies, some of the clients will not be able to be absorbed in the mainstream social housing sector upon completion of that period. So the government announced further funding for capital supply, and now the program stands at 177.5 million, which includes a component of 250 additional dwellings for those rough sleepers to be able to exit into long-term social housing. So in terms of the success of the program, I think we are now looking at more than 1,100 clients being supported through the program. We think we now have a template for any future programs because I think a lot of that early work has established a really solid foundation for a future program. Another thing to note in the Together Home program is that 30% of the client group is Aboriginal as well. So we put in place an Aboriginal-led model on the Central Coast that also is going to provide a good template for how we roll out this program in the future. So the challenges for the program is, of course, the tightening private rental market. As we all know, the borders have opened. Those opportunities for rentals in the inner city are drying up. The opportunities for rentals in the regional areas have already dried up, I think. So there is a struggle to find housing. But you know, we have started to sort of look at our long-term housing options and new social housing supply as well to support the initial work done. The other big change that happened through COVID in New South Wales was the way we managed temporary accommodation. Initial caps on services were removed when the pandemic first happened, and clients were allowed to stay longer in temporary accommodation until a housing solution was found. There was a concerted effort not to allow exits into homelessness from temporary accommodation. And again, Together Home was one of the exit options for a lot of those clients who were in temporary accommodation, and they were there for a long time until a housing response was being found. So there was a sense of urgency when we were delivering the program. In addition to temporary accommodation, we also provided funding for emergency accommodation to specialist homelessness services, especially those which required clients to self-isolate or deconcentrate refugees. So I think the other two things I want to quickly mention are long-term housing options. So now New South Wales already has a significant new supply program through Communities Plus, through Social and Affordable Housing Fund, through Community Housing Innovation Fund, and those dwellings, and the dwellings that Land and Housing Corporations redevelops as well. So where it was possible to expedite some of those projects to bring supply online quickly, additional funding was provided. And again, as I said before, that we realized that we needed to provide support across the housing continuum, not just focus on the crisis end. The other thing that we did was to expand private rental accommodation, another extra 20 million to support people in the private rental market, because we knew that there were a lot of people who had lost jobs, who were struggling, and even in some of those program settings where rents taper up towards the private market, all of those things were sort of stopped, and people were allowed to stay on the same rental level for a longer time. With crisis accommodation, I think it would be remiss of me not to mention our major investment in crisis accommodation, which is the package announced in October 2021, $483 million, $426 million of which is purely for building new crisis refuges for women escaping domestic violence. This investment will double the number of crisis refuges in New South Wales. And again, work has commenced. Some of you might be participating in the tenders that are out there. So I think that kind of covers, in a nutshell and very quickly, a massive initiative that the state commenced. I haven't touched upon the vaccination bits that Ben covered, and again, I think there was a concerted effort not just to vaccinate our most vulnerable clients in temporary accommodation, but also in congregate care facilities. There was quite a concerted effort to do that. Also in social housing blocks, unit blocks, where there were concentrations of people. And a lot of work that happened with health in terms of accessing specialist health facilities for really vulnerable clients, especially those with mental health conditions. So moving on to the next slide. This is just kind of summarizing how we increase system level capacity. So as I said before, supporting vulnerable people during the pandemic and more recently natural disasters. So as you must be familiar with what you've heard on the news, we've had major flooding in northern New South Wales, and before that we had bushfires, of course. So the dimensions of homelessness have expanded, and we have invested considerable amounts of money to assist people who are now facing homelessness due to natural disasters as well as COVID. As I said before, in terms of just assertive outreach, that we did 11,116 assertive outreach activities in the last couple of years. In 2021 alone, 70,600 clients received support through the Specialist Homelessness Service System. I've mentioned the Together Home figures before. That's roughly around the 800 mark and growing as we implement Tranche 3 now, because Tranche 3 has just started, which is again another 250 packages. And the social housing supply in the last couple of years is around 3,000 dwellings, both through the Social and Affordable Housing Fund, through some of the LAC redevelopments, and the Community Housing Innovation Fund. Now, the last bullet point is not specific to COVID, but I thought it's worth mentioning because I think our investment as a jurisdiction in the community housing sector is paying huge dividends. Over the last many years, we have built the community housing sector in New South Wales that manages and owns some of it, of course, more than 50,000 dwellings in New South Wales. And we rely on them and their capacity on an ongoing basis, not just to deliver programs, but also deliver new supply, because a few years ago at the last GFC, we transferred the title of a lot of dwellings, nearly 6,000 dwellings, to the community housing sector. That started off building their balance sheets, which they borrowed against. And also we've done a lot of management transfers that has improved their cash flows. And that investment in the community housing sector is paying off in a big way. If you look at the figures released from Community Housing Industry Association most recently, we are looking at a pipeline of 2,600 dwellings to be delivered by the community housing sector by in the next 4 years. I don't have it on the slide, but I know by 2016. And then since 2012, the community housing providers have delivered nearly 5,300 homes and an investment of 1.8 billion. So that's no mean feat. And so we are reaping the benefits of that long-term investment in the community housing sector. So this slide is just giving you a flavor of all the funding commitments, especially around the COVID response. It's nearly $1 billion, more than 950. And some of the items I've mentioned through my presentation already. So I won't dwell on that. These figures don't include the most recent budget announcements for the 2022-23 financial year. That was a major housing package that didn't just focus on social housing and homelessness, but also affordable purchase and a lot of support for people affected by natural disasters. But that information is publicly available if anybody's interested. So key learnings, very similar to other jurisdictions. I'm sure that we as a government, we have to be flexible and adapt our policy settings in the face of a crisis, and that's what we did. We changed our policy settings around TA. If you look at Together Home guidelines, they literally evolved over the last 2 years. We listened to the sector and we changed the guidelines to make sure that the program fit well the actual needs of the clients, and we don't force the clients to fit the needs of the program. We've leveraged the capacity of the community housing sector and the specialist homelessness services, their expertise. We've listened in real-time inputs. Actually, there were a lot of real-time inputs into our policy settings because we were getting feedback from the ground, and because of our inclusive governance mechanisms, we were hearing what was happening on the ground, and we were rapidly amending our policy settings as we went along. And again, I think the common cause of in the face of a crisis, people do come together. And I think the challenge for us is how we harness that energy and take it forward. I think the relationships of trust and respect we've built with the sector over the last many years is our biggest strength, really, as a jurisdiction. And I think we again and again call upon our industry partners to come and help us deliver services to our vulnerable clients. And that has been a key learning and an ongoing learning for us as a department. So these are just like, this is this last slide, and this is just random thoughts. But I think if we are to think of a plan to end homelessness, what are the critical elements of it? How do we keep this energy and collaboration going, and not just in a crisis situation, but on an enduring basis? How do we create practice and policy environments that are flexible, that foster innovation, that allow people to come with us on the journey? We want a plan that addresses the need at all levels and throughout the housing continuum, not just crisis, but social, but transitional housing, affordable housing, private market interventions, and private market assistances. We know that Housing First works. So what shape would an enduring Housing First program take beyond the pilots and beyond the time-limited initiatives that we've implemented so far? And how do we identify sources of funding for all of this work? We need massive investments in social and affordable housing, and the Housing Australia Future Fund, of course, is a great option for that. And all jurisdictions are looking towards the Commonwealth and how we can work best with them to get funding for our various jurisdictions and increase the supply of social and affordable housing. How can we create the environment for attracting investments? And what are the policy settings? What are the subsidy settings to allow that investment to be attracted to the sector? And of course, there will be state government commitments, because we will work hand in hand with our colleagues in Commonwealth, with local government, with the sector that we cherish and value so much. So I think these are my closing thoughts. And with that, I will just leave it to the experts to use the technology.
You've picked the wrong person. Well, thanks, Humair, for that lovely overview of the New South Wales collective effort. So I'm going to encourage your questions so we can hear a little bit more from Humair later. To provide our first sector perspective, we have with us HA board member Frances Crimmins. Frances is the Chief Executive Officer of the YWCA here in Canberra, a leading feminist not-for-profit organisation. YWCA Canberra provides integrated and specialist support in housing and homelessness services and supports women and their children escaping family violence, as well as providing a range of other community services. And Frances is passionate about supporting people experiencing homelessness, with a particular interest in addressing the needs of older women and women and children at risk of homelessness. Welcome, Frances.
Thank you so much, Jenny. And thank you everyone for attending today. I too would like to acknowledge that we're meeting on the land of the Ngunnawal people, and thank Auntie for that beautiful welcome to country. My family's only been on this beautiful Ngunnawal land for a millisecond to the Ngunnawal people, and I echo that it is a beautiful country. And I encourage you all to get up, brave the -1 morning, enjoy our bush capital. You will come back in very invigorated, ready for tomorrow's big day. So in terms of the ACT government response, working in partnership with the sector, that's what I want to talk about from the sector's perspective. So here in the ACT, we had a few weeks where we were observing New South Wales and Victoria, being surrounded by New South Wales and observing, and we were a few weeks behind in the Delta outbreak. With hotels, and in fact we supported 256 individuals and families with an average stay of 40 days in hotels. The Housing ACT also made properties available. 40 transitional properties were brought online, increased to 76 today, and an additional 330,000 was made to the homeless specialist services, was made available to provide the support to those people in those houses. But what I really want to focus on sharing with you is what I think was a first that the ACT response did. And that was actually coming to the sector and doing a purpose-built quarantine facility that was not just about helping those people who were positive with COVID, but to actually provide a person-centred response for some of the most vulnerable Canberrans who really, when I share some of their stories, having COVID was actually the least of some of these people's challenges. And the first point I'd like to make is when this decision was made, we stood up this facility within 4 weeks. And the key decision was to invite the specialist services to come to the table to design what this would look like. So if you need to rapidly hack a system, the best place to come to is the experts who work in the system. And the experts who know their clients, who have their clients' voice, and will bring that voice into the design of any system. And that's a really key message for anybody designing a system. So within 4 weeks, a holiday village was rented, and I think that's really important as opposed to hotel rooms, because this holiday village had 1 bedroom, 2 bedroom, 3 bedroom, ensuite facilities with their own private open space, fully equipped kitchens, a space that you could actually be comfortable in, and in normal times people choose to holiday in. So first of all, we provided an environment that was warm and inviting. The next key aspect was, as I said, it wasn't just a health response and a quarantine response. Through Housing ACT and CSD, they invited the homeless specialist sector to put forward how we would support people to successfully quarantine and stay in that quarantine facility for a minimum of 14 days. And we're talking about some of the most vulnerable people in Canberra community. So we were able to partner with YWCA Canberra as the lead, and we partnered with multiple homeless specialist services here in Canberra Directions Health were able to provide that really important vaccination need to support people who required drug and alcohol support. We partnered with peer worker group, Karma, who were able to talk to their clients when they were in that quarantine facility. We partnered with the Mental Health Foundation. We reached out to our other specialist housing providers, Catholic Care for Youth Specialty, Anglicare. YWCA were able to provide the domestic and family violence care. Within 4 weeks, we had put together a team of 12 specialist staff to be on site from 8 a.m. to 10 p.m. and an on-call service to meet the needs of those people. I'm really pleased to say that we didn't have one quarantine breach, and that shared assessment of both the clinical and psychosocial needs, we were able to successfully quarantine and manage the psychosocial needs of the people who were in that beautiful facility. So the key learnings that I think came through that was working with Canberra Health Services, having them on site, working with specialists in the homeless sector. We were able to, what we think is an Australian first, develop both a clinical health assessment but a psychosocial assessment tool. And the feedback from those people who were developing that tool and refining it every single day we were on the ground for the 12 weeks was that it was a career highlight for them. Everybody there wanted to make this model work. And the other key importance about this model was we also knew when we had to start exiting people. So from day one, when somebody came there who was COVID positive, the training of the staff to support people who were COVID positive also came in. From day one that we were made aware of them, we were working on an exit point, on a housing strategy for them. So nobody was exited back into homelessness. And I think that's a really important key learning. The other thing that we found out that through this process, with all of the special homeless services who were involved, at least 50% of the people who came through the Ragusa site were not known to any of us. So we think we know all the rough sleepers in Canberra in this jurisdiction, but what this showed us was that actually we don't. So that's another key message, is that the statistics only scratch the surface of those who need a housing homelessness support. So since we had to wind up that program, it ran for 12 weeks, we have done a detailed review of the service with the many stakeholders who were involved. There's many learnings, and I think the first is in the governance model. And my message to government is don't be fearful of having the sector at the highest levels of your governance models. Have us at the table at the executive level, not after those decisions have been made. The next key message is that when you provide a holistic response and it is person-centred, you are able to look at the complex both health and wellbeing needs of this model. This model for some of these clients and consumers turned people's lives around. We were actually able to divert people from the judicial system. We were able to facilitate and identify women with children who weren't known to the local domestic and family violence centres, and able to actually get them long-term support and help them exit violent relationships. We were also able to work with unaccompanied youths, which was a key first. And in order to do that in the governance model, we need to look at an opt-out model, not an opt-in. That was our first challenge, was that it was all around these people were coming to a health facility, but there was all this amazing wraparound support. So we really need to get that it is an opt-out model and let people opt out of that additional support, rather than when you're at your time of need trying to get them to opt into every support service. I think the other key learning was that if we really want to stop this cycle of support, we need to then look at the bigger picture. And if we really are going to be successful in a national plan, we need to look at the welfare system, because ultimately we were exiting people into poverty. We are exiting people into a punitive welfare and a mutual obligation measures that have made, particularly in the area we work, the lives of women and children exceptionally hard. You can't expect somebody to rebuild their life after homelessness if that is the social support system that is in place to help them carry forward with their lives. So I'm conscious of time, and I know I've got an amazing sector person coming after me, so I'll leave it there.
Oh, thanks, Frances, for sharing your practice wisdom and bringing to life the collaboration that, understandably, for some was a career highlight. Our final panellist and second sector perspective comes from Chris Burns, who became the CEO at Hutt Street Centre in South Australia in January 2020, just as the pandemic broke. Chris has a long background in the military, and he's been the CEO of South Australia's peak defence industry body, the Defence Teaming Centre. Chris was then invited to be the inaugural South Australian Mental Health Commissioner, where he led the co-design and co-production of the state's first mental health strategic plan. It's great to have Chris with us.
Thank you very much for that, and I echo the acknowledgements of all previous speakers, but also acknowledge I'm the fourth speaker on the same topic, and I stand between you and drinks at the welcome reception, so I'll stick to my notes. Today you've heard some great insights into how the outbreak of COVID and the pandemic have been managed in the homelessness sector at the strategic level from a government and interagency perspective. At Hutt Street Centre, we're a provider of specialist homelessness services in Adelaide, and I've been asked to give you an insight of how we manage COVID at the coalface in South Australia. So we're going to drill right down. At the onset of COVID, our greatest challenge was to work out how to educate our clients as to what COVID was and why they needed to maintain social distancing and wear face masks. Some early riddles for us were around how could a rough sleeper get tested for COVID when we only had drive-through testing stations? And if they did get tested, how did they isolate until they received their results? Indeed, how did they get the results when the results were only delivered by SMS text message? And then, of course, where would the clients isolate if they tested positive? And if they did test positive, how would we identify who their close contacts were? And if the close contacts were rough sleeping, how could we get them tested and where would they isolate? Just a few challenges. In early March 2020, a number of providers of specialist homelessness services in Adelaide, namely Nemai, Baptist Care, the Service to Youth Council and Hutt Street Centre, rapidly came together and collaborated with the South Australian Government to develop an emergency accommodation response known as the COVID Emergency Accommodation for Rough Sleepers Program, or CEARS. Fortunately, the government were quick to agree to fully fund housing of CBD rough sleepers in hotels and motels as emergency accommodation. We were grateful of the government's generosity, but they were quite surprised when we argued that the rough sleepers needed to be treated the same as others experiencing homelessness and in emergency accommodation. We felt they needed to make a financial contribution to their accommodation commensurate with their earnings. Our learning was that it is important the clients had to have skin in the game and were held to a level of responsibility for their accommodation. The government argued and prevailed that COVID was a community health crisis and they couldn't risk rough sleepers refusing accommodation on the grounds that they had to contribute financially. The next step at debate was the need for additional resources to fund the provision of case management for rough sleepers going into emergency accommodation. And this proved quite problematic from a workforce perspective. Our existing case management workforce had to continue to support their existing caseload. Indeed, the demand increased as they needed to provide more comprehensive case management of their existing caseload in the pandemic. Fortunately, our sector is blessed with a highly compassionate, can-do workforce that exhausted itself to address the existing and new caseloads. Having agreed to fund hotel accommodation, we were pleasantly surprised by the number of hotels and motels, many of them high-end, that stepped forward and offered rooms. At the time, the Adelaide Zero project was well established, and as a consequence, we were reasonably confident that we were supporting approximately 150 rough sleepers in the Adelaide CBD. In the first week, we accommodated 240 in hotels, and within a month, over 300, all who claimed to be rough sleeping in the CBD. Any hotel that agreed to accommodate our clients was rapidly filled. It soon became clear that providers of specialist homelessness services outside the city with no COVID response options justifiably advised their clients to travel to the CBD and to be claimed to be sleeping rough there. We also learnt that a number of clients who were not happy with their long-term accommodation simply returned to rough sleeping in the city in order to qualify for the accommodation in the high-end hotels on North Terrace. And all was going well initially. We divided the hotels between the service providers, and each of us focused on visiting our assigned hotels each day to support the clients. Doubtless there was a perception amongst some clients that hotel accommodation would come with the trimmings of room service, fine dining and free minibars. Managing those perceptions was a challenge for a few, but for most they were extremely grateful for the accommodation. And I'll never forget talking to one client and asking how good it felt to have a comfortable bed and a roof over his head each night. And he agreed. But most important to him was the fact that he could lock the door and feel safe enough to sleep at night, something he said he had not done since he started rough sleeping a number of months before. We were all extremely supportive of the federal government doubling the job seeker allowance at the end of March. I well recall the nights of the first payment of the increased allowances. Understandably, some of our clients felt free to enjoy and indeed celebrate their newfound wealth and living space. We would later learn that the drug dealers in the city had visited our clients offering free products in advance of the increased allowance. Not surprisingly, on the night of the allowance was being paid, they revisited our clients and offered their product at twice the market value. I also understand the local bottle shops enjoyed increased patronage, and some ladies and gentlemen of the night benefit from the opportunity presented. Unfortunately, the consequences of the increased drug and alcohol consumption led to a number of unfortunate situations and significant property damage that left us with no choice but to disperse our clients across multiple hotels and motels throughout the city. While this addressed one problem, it created another. We now had to provide more intense case management support to over 300 clients dispersed across 27 hotels and motels throughout Adelaide. Some had cooking facilities, a lot didn't. Some were convenient to public transport, a lot weren't. Some had free internet and streaming services, but many had none. Outside lockdown periods, we felt it was important to encourage clients to make the journey into the centre occasionally. It gave them a chance to get out of their accommodation and to get fresh meals and access our other services like the nurse or a change of clothes. As time went on, we realised we needed to focus on the longer term as COVID was not going away, and the state government agreed to fund an expanded workforce. Unfortunately, the capacity to recruit a new workforce as we neared the end of financial year 2019-2020 became quite problematic. This was compounded by the state government's announcement that they were intent on driving reform in the sector and introducing an alliance model. This created a situation of great uncertainty for the existing workforce, and it also proved to be a significant distraction for the leadership groups as the tender process drove division within the sector. Now, this is not a criticism of the alliance model, but more the timing of the reform in relation to COVID. The other competing demand was the state government's desire to get clients accommodated in hotels and motels under the COVID initiative out of that accommodation and into housing as rapidly as possible to reduce expenses. This left us with a situation where many clients in temporary accommodation and awaiting a housing allocation prior to COVID were effectively placed on hold. while rough sleepers who'd been rapidly accommodated in hotels and motels under the COVID initiative were given priority to housing allocations. In conclusion, at the end of our SEARS program, over 540 clients between the ages of 19 and 67 were accommodated in 27 hotels and motels. Of the SEARS clients that Hutt Street Centre managed, 97% were not sleeping rough by the end of the program, and 80% were in stable accommodation with at least a lease of 6 months. So, did the SEARS response end homelessness in South Australia? In my opinion, no. It was a major disruptor. It rightfully provided emergency accommodation for rough sleepers and expedited their housing allocation. But the solution to ending homelessness is the provision of sufficient housing to address the demand, and for the person occupying the house to have a sense of homefulness. Homefulness is about living in a place that you call home because you feel safe. You call it a home because you experience a sense of stability and privacy, and you have the capacity to control your living space. You feel a sense of homefulness when you are connected to your family and loved ones, and you believe you are part of a community. As importantly, you feel you are contributing to that community. Homefulness empowers a sense of independence. When a person experiences homefulness, you end their homelessness. Thank you for the opportunity to speak today and provide you with our insights from the coalface.
I'm collapsing a little bit early here. If I can just mention that I'm not seeing any questions on the app. So my special expert from Humair might come and help me. But thank you, Chris, for that just fabulous on-the-ground perspective and a real feel for the logistics that specialist homelessness services faced in South Australia, and conveying the advocacy that was needed and the experience of rough sleepers and the successes also of the sector. And I'm still not seeing any questions on the app. So I've been a terrible chair a few times in the last week. Here we go. Freshening up the iPad. But we've got time for a couple. So if I can ask the panel, given the high numbers of Aboriginal and Torres Strait Islander peoples in the stats, what measures, if any, addressed closing the gap reforms for ACOs to deliver these services? Any of you keen to speak to that? Ben? Chris?
I'm happy to have a go at that. I mean, I think the sector in Victoria tried very hard to build ACO service delivery into all of the programs that we talked about. I think we are on a journey of increasing ACO ownership and self-determination of homelessness service delivery to First Nations clients. And I think that the COVID experience reinforced our place on that journey, which is, still with quite a long way to go. I think we did a good job on that front, but I think there was more that we should have been able to do and couldn't achieve in the time that we had available to us and the circumstances that we had available to us. I think over time we're pretty clear that we need First Nations people who are experiencing homelessness in Victoria to have the option of service delivery through a self-determined ACO funding and service delivery model. And we don't currently provide that as much as we should today. So there's still work to do on that front.
Okay, we'll hear more about that tomorrow. Humair?
Sorry, I was just about to say that, just echoing what Ben said, that I think the time frames when the pandemic first hit and having to stand up programs very quickly didn't allow that full engagement and capacity building for those programs to be taken on by some of our Aboriginal community housing providers, and that's definitely something that's in our thinking. And if a longer term enduring program is developed, definitely that will be a priority for New South Wales as well.
Yeah, I was just going to
Frances?
echo that we need to see, here in the ACT, Aboriginal Torres Strait Islander controlled homelessness service provider, and then that building on that a housing provider. We don't have. We need that. We also need to learn to partner better in the homeless sector and make sure that our staff are culturally appropriately trained, but where possible, partnering with and handing over services to Aboriginal controlled services.
You get a few here's from most of us around the country, Frances. And Chris?
I think our experience with COVID was that statistically it wasn't a higher percentage of First Nations people. We were very fortunate we had Baptist Care, who have a particular expertise in supporting First Nations people, and they were able to set up the specialist culturally sensitive and appropriate locations to support the Indigenous people.
Thanks, Chris. Many regional and rural communities have underutilised housing and land. What capacity is there under Housing First approaches in the use of these resources to support the homelessness response? So I guess it's really about trying to leverage opportunities that might be available, right across the country. Humair?
Yeah. So I think that's a fair point. I think there are opportunities across the state. I think there are opportunities in low land value areas, there are opportunities in high land value areas, and I think as part of a national plan, we need to look at all those opportunities. There are a whole plethora of land owning entities, whether it's councils or whether it's Aboriginal land councils, or there's state government land, surplus state government land as well. So I think as part of a plan, we need to look at all these opportunities and across all markets, definitely.
Chris?
To say that it's great to have the housing, but in the regions it's more difficult to get the case managers to provide that support. That if you don't have that wraparound support around clients when they do move into the houses, it doesn't work properly. So it's having that backup support as well.
Yeah, and I think our colleagues from government sort of indicated it's not always easy to get that in an enduring way. Yeah. So I have been did you want to say something?
I was just going to echo the workforce challenges, but in regional and remote communities, and that we need significant investment that we can have that on, and I think we also have to recognise that some people will need support for a long time, and right now the emergency funding tends to be focused on that 3 months. It needs to be much longer, and you need a workforce that there is that investment that you can, if we need to. Some of our chronic homeless people might need support their whole lives.
Yay. All right, well, I have been a terrible chair and we have run out of time. If I can thank our 4 speakers for the opportunity to think about the last 2.5 years in terms of what happened in at least 4 states and territories, the innovation that occurred, what has stuck, and what are the vital bits that we need to make sure in the forthcoming National Housing and Ending Homelessness Plan. And if I could again thank our sponsor, which, if I can get the title correct, is the New South Wales Department of Communities and Justice. We'll be saying farewell to our friends online rather shortly, and there will be a survey about the session, which we'd really appreciate you filling in to give us a perspective for future planning. And I will now hand back to Michael.
Thank you, Jenny, and thank you to the panel. It was a really thought-provoking session, a lot to go through, and while question time was a bit limited, our panel will be joining us at the welcome reception, so you can bail them up there over a glass of something. I'm just back very briefly to wrap things up and tell you where you need to go next. The welcome reception kicks off at 6 o'clock at the National Museum. The buses will be departing from the park entrance of the Convention Centre. That's to the right as you exit the theatre here. Buses start leaving at 5:30 through till 5:50, so don't miss out. Please be aware that masks are mandatory on the bus, so please ensure you've got one. If you don't have one with you, the staff outside will give you one. Also ensure that you're wearing your lanyard, your identification as part of the conference, as that's your ticket into the function. The function will run from 6 o'clock till 8 o'clock, and buses will start returning from around 7:30. They'll be making various drop-offs in parts of the city. There'll be signs outside each bus indicating where it's going, and there's a concierge there who'll help work out which is the best bus for you. While you're there, check out the Great Southern Land exhibition, which has been made available for us as a special viewing tonight. It's a terrific exhibition, well worth a look. Otherwise, I look forward to seeing you there shortly and back here tomorrow morning from 9 o'clock. Thank you.